Hello, everyone. This is Dr. Ria, and let's practice some mandible anatomy. I will discuss a label diagram of mandible, and we will label one by one. Okay, so here we have at point A the coronoid process. On point B, we have the neck. On point C, there's the head. On D, it's ramus of the mandible. On E, as you can see, angle of the mandible. On G, the foramen is mental foramen. On H, the foramen is mandibular foramen. And on F, it is the body of the mandible. You're doing so good. If you learn the basics really well, you will understand the mandibular anatomy perfectly and you will able to diagnose any fracture, any pathological condition, and it will really help you during your block administration and in generally infiltration of the local anesthetic. Let's discuss some important points of the mandible. Here we can see, unlike the rest of the skull, the mandible is the only bone that can move freely. This mobility comes from the DMJ, which acts like a hinge and a sliding joint, letting us talk, chew, and express emotion. Okay, the mandible is the biggest and strongest bone in the face. It's built to withstand powerful bite forces, especially in the molar region, thanks to its density and its thick structure. Did you know at birth, the mandible actually starts out as two separate bones? These fuse together during the first year of life at the midline, an area called the symphysis mentae, forming a single unified jawbone. Even though the mandible and maxilla work together when we chew or when we speak, they actually do not touch. Their coordination is made possible by muscles of mastication and the TMJ joint. Mandible canal carries the vital structures. Running through the mandible is a hidden canal that protects the inferior alveolar nerve, artery, and vein. These are essential for sensation in the lower teeth, chin, and lower lip, and these must be preserved during surgery. Thank you so much for watching. I hope you learned something. Subscribe for more.